I was attracted to come because of the research environment, particularly from the perspective of academic radiotherapy. There are very few centres in the UK that really have the interest, the expertise and all the technology to really be able to support an academic radiotherapy department.
Leeds as an oncology centre is highly respected, and we're already leading in terms of stereotactic ablative radiotherapy in lung cancer, and so this is the natural place to try and develop treatments in other tumour sites.
Just thought I was ill with a really bad cold and really bad headaches with it. Saw my local doctor who gave me some antibiotics. He said if there were no improvements they would have to look a bit further. I was so ill, I almost collapsed, lost consciousness. I was sick. This led my husband to take me to the hospital straight away, where they discovered that I had a brain tumour.
Brain tumours are rare cancers. They're challenging because there is no way of screening for them. They don't respond very well to treatments that work quite well for other tumours, and they develop very quickly, so it's a scary disease.
I had the tumour operated on within 5 days. 90% of the tumour was removed, and then I started the road to recovery, which included radio and chemotherapy.
The group of tumours that we obviously worry about are the malignant tumours, and some of these are associated with really poor prognosis.
From the moment they walk into the clinic, you know that you've got to treat them as though they've got a terminal diagnosis. They want an option, and they want something that gives them some hope that things might be changing. You have to really think from the start about treating the whole patient, thinking about their family situations, thinking about their social support. Here in Leeds, we've got the right team to provide that.
I'm just treated on such an individual basis here. They've given us such good support and understanding in such a fantastic environment, which means such a lot to me and the family, and it's the people that make it.
They really feel much more confident when they're in a nice, modern, bright, well-functioning environment, and I think we've really got that here.
It is the latest place to come and get treatment, and it is a world leader.
We're one of the most active groups now in the UK in terms of bringing new treatments.
There's really a good team, there's an enthusiasm for research, and the technical expertise is available as well to give me support to allow me to research as effectively as possible.
We live on the same site as a major hospital. We work very closely with the physicians, and so we can move things very quickly from the laboratory through to the clinic. It's about our ability to translate biological ideas into patient treatments.
It's very nice to feel that the patients that come here will get offered new treatments. We really feel that we're helping move the research agenda forward. The whole research effort depends on lots and lots of different people and lots of different funders, including the big charities like Cancer Research UK and the MRC, some local charities including Yorkshire Cancer Research.
Well, money is essential in science. We can't do any research without being funded. We need to be able to develop all our preclinical models in order to take them into the clinical environment. So the money will help us to develop things that we can use in the lab to understand the proof of principle of research, which we can then take forward in clinical trials and deliver to our patients.
You take those successes and then you can carry them through, and then get other long-term funding to develop it further. Alumni support is critical to us. I see alumni funding as giving us that flexibility to take the opportunities that are available here and to be able to get that to the patient as quickly as possible.
There are specific things that really make a lot of difference. One of the things that we would really value some help from the alumni for is to support some new PhD programs.
We're always looking for bright people wherever they are in the world to try and encourage them to come here.
It means that we have bright young people who become interested in our research and who then take the research forward for the rest of their careers. So that's an extremely good investment.
It's about the publications that I can get out of my work to get my research into the wider clinical arena and let people know about the things that we're doing here in Leeds. We're really excited that the work we're doing in the lab is already being designed and translated into a clinical trial that we want to deliver, and funding such as from the alumni would allow us to do this much quicker and take this to the clinical environment to get outcomes.
In the next few years we will be bringing more and more new treatments from the lab into the clinic. We want to broaden the opportunities there for patients when they walk into the clinic, so that I will be able to tell most patients when they come in that they've got a challenging disease but that we've got some new treatment options for them.